Hello, my name is Adam Smith. I work at University College London, and I'm here today to present our review of the impact of the COVID-19 pandemic on joint dementia research volunteer registrations and study recruitment in the United Kingdom. These are my disclosures. So first of all, let's talk a little bit about what joint dementia research is. Essentially, this is a service funded by the UK government, run by the National Institute for Health Research and supported by Alzheimer Scotland, Alzheimer's Research UK and Alzheimer's Society. It allows anybody aged over 18 with and without dementia to volunteer to participate in research studies. The information they provide, which is some mandatory and non-mandatory information, is used to match them with the criteria provided by researchers to enable them then to perform a screening and to contact them afterwards. It's promoted far and wide across the UK. There's been a lot of lessons learned over the years to understand how best to reach different populations of people. However, recently there has been a shift in emphasis to particularly try and increase numbers of people living with a diagnosis, because people without were naturally finding it and there were much higher numbers anyway. So that has shifted a focus particularly onto healthcare settings. Also as well, we've learned that trying to make sure people are aware of this as soon after diagnosis as possible makes a big difference to registrations, because that seems to be when people are the most motivated to find out about it. People can sign up for themselves and on behalf of others, and quite often that's what they do. You can register over the telephone by the telephone helplines provided by the charities through a free post paper-based application form and in the website, which is fully accessible. Let's now look at volunteer registrations. So of course, tracking the sources of where people find out about joint dementia research is very important to make sure that the promotion work done is working. This graph here shows the registrations down the right-hand side and where they hear about it down the left. And this is for the whole time the service has been running. And you can see healthcare providers and charity partners are the two biggest sources of information about this, followed by news, which tends to come in spikes as items arrive, internet searching down to friends, events. And some might be surprised that despite a considerable amount of effort going into social media promotion, it's only contributes a small number of registrations. So this is a number of people living with dementia registering on JDR. As you can see, they've been incredibly successful in raising the profile and to attract people with a diagnosis to register. And this is tracking about 100 per month more since this recording started. You can see at the bottom of the graph for the months, up the side of the number of registrations. And as much as this rises and falls month on month, the trend line shows there's been a steady trending increase in registrations since this reporting began. Slightly different picture. This is the same graph again, but just focusing on people without dementia. Slightly tracking lower, but I think that shows the shift in emphasis to try and attract more people with dementia. In fact, about 80% of the people on the service don't have a diagnosis, but the majority of those are over the age of 40 and 50. The black line on this table represents January 2020. To the left of the line are registrations before, to the right are what happened afterwards. This is focusing on people without dementia. And you can almost immediately see the drop-off came in February 2020 when news of the pandemic spread. And we'll look at particular activities in a few slides' time. In fact, the overall reduction was 51% of people without dementia dropped in 2020. And when we look at people with a diagnosis, it's a very similar position. In fact, slightly worse. There was a 52.5% fall in 2020. And this would actually be closer to 60% if we were to take January out of this calculation. Coming back to looking at the sources of where people heard about joint dementia research, this graph compares the sources of referrals from 2019 to 2020, 2019 being the blue line, 2020 the pink one, across the bottom, you can see the sources. You can see the biggest drop came from places like GPs. Now, this has combined both people with and without a diagnosis in terms of their registrations, but you can see the biggest drop came in GPs. In 2019, almost 800 people found out about joint dementia research through their family doctor. In 2020, that fell to under 250. And it's a similar position over here in healthcare settings. And of course, as you would expect in events. What seems to have maintained very well, of course, is the charities' fantastic efforts to raise awareness through their newsletters and activities and their outreach work. This actually maintained levels quite well, but across the board, there was a fall. And when we also now move on to look at why this might be, this is the plotting pandemic activities over registrations. And we can see this is when non-essential travel bans began in February 2020, followed by a lockdown in March. And that's when registrations hit a very low level. There was a phased reopening of non-essential shops, further easing of restrictions. Then we see slight rises. And then the worst fall to lowest levels of around 100, just over 150 people in total registering, came in December 2020, when you had the combination of a second lockdown and a seasonal drop, which joint dementia research always experiences anyway. So let's have a look now at what was happening in the healthcare settings during the pandemic to put this into some context. So across the NHS, there was a 6.3% fall in diagnosis rates, and in every other measure you can consider, from GP assessments, referrals to memory clinics, and memory clinic undertaking assessments, all fell by almost a half. At the same time, a lot of the people involved in promoting joint dementia research in those clinics were diverted to vitally important COVID-19 research. So the people weren't in the places to promote it. There were fewer services running at all. And of course, services moving online digitally meant that they weren't necessarily prepared, and the focus was on talking about healthcare, quite rightly, and that person's condition, and not necessarily on talking about joint dementia research. This compares 2018, 19, 20, and 21, just looking at April, and we can see these were the registration levels in 2018 and 19, people without dementia being the pink, the blue being people with a diagnosis. And we can see that the numbers fell by, visually you can see how much they fell by in 2020. But the great news is in 2021, there has been some recovery, and registrations of people living with dementia has almost recovered back to 2019 levels. But surprisingly, the levels of registrations amongst people without a diagnosis have not recovered at the same pace. Another piece of good news is Alzheimer Research UK's report that shows that there's 69% of the people they surveyed would consider participate in medical research for dementia. Now, we haven't seen this come through into reality yet, but I think there is a challenge to work out how we can convert that enthusiasm into registrations. Now let's look at study recruitment, which is quite the contrary picture. Study recruitment in 2020 and 2021 reached an all-time high. There was a 139% increase in study recruitment, although fewer individual studies being recruited too. Now, again, thinking about what was happening in the wider NHS at this time, many studies were suspended across the UK to divert resources to vital COVID-19 research. So lots of studies stopped. Some of the studies that were carrying on had to relook, particularly student research, to move to how they could deliver the same trials, but in a non-face-to-face way. And this is where, of course, joint dementia research, which can be utilized at home at any time of day, is a perfect tool to enable continuation of recruitment even when clinics are no longer functioning in the same way. We also saw a change in the profile of research going on, and this is demonstrated really well through this graph. There's the month along the bottom, enrollments in the top. And there was a single month here in April 2020 when nearly 4,000 enrollments happened in a single month. And as we move on with this graph here, because what we saw were fewer studies recruiting higher numbers of people rather than higher numbers of studies recruiting small amounts. And this is no surprise, because quite often drug trials may be looking for only a dozen or maybe 50 people, whereas surveys look for high numbers of people. And so in 2020, Join Dementia Research recruited 23,000 people into 125 studies, and even managed to shift to support 6,719 instances into the new COVID research, which was rapidly commissioned to look at the impact of COVID-19 on dementia. So Join Dementia Research was an amazing tool to support that, in like no other tool could have, because of course NHS services weren't functioning the same way and vulnerable people were at home. So what does all this tell us? It tells us that Join Dementia Research was very fortunate to have sufficient numbers of volunteers to enable it to continue to be effective during the pandemic. Join Dementia Research actually increased recruitment to studies in 2020 despite lower volunteer numbers, and was capable of supporting the new profile of studies because of the people that it had on the register. And I think overall what this demonstrates very well is that registers as a whole and Join Dementia Research provide a great mechanism to match and continue to support study recruitment, even when clinical services are affected, but only providing they already had sufficient number of volunteers. If you didn't have enough volunteers already there, it wasn't going to help you, because it was very hard to attract them to the register. There are also, I think, worth mentioning a few lessons for the future. I think it's important that services like Join Dementia Research consider ways to ensure it can continue to attract volunteers with dementia, even during the pandemic, particularly at the earliest stages, and to not be dependent upon memory clinics communicating that in a face-to-face way. So developing some kind of digital mechanism to do that, or even postal letters at that time, would be very efficient to be able to be more robust through that process. And also, I think, to take advantage of what Alzheimer's Research UK found out in its survey, to take advantage of that public enthusiasm to work out the right messaging and the right way to deliver that, to try and more quickly recover the fall in registrations of people without dementia. I'd like to thank all those involved in supporting people living with dementia to sign up to Join Dementia Research, particularly the clinical services, also the people, of course, who register, the National Institute for Health Research, and the charities involved in making all of this possible. Thank you.